Welcome to CenterPointe Columbia, 30-bed edition. This is where the patients will enter the wing after going through intake and assessment. We've got an outdoor courtyard there. That's actually just for staff only. EVS closet and a storage room. This is strictly for exit purposes only. It's our Sally port, so badge to get in. The doors are interlocked so that you can't open the second one until the first one is totally closed, and then you can enter the unit. We do have our soiled holding room there off to the right, clean storage here, as well as laundry, 2 consult rooms, and another consult room around the corner. Got our noisy activity room here. Med pass window there. The coil down, cooling door is currently down, obviously. Typical consult room. So the ceilings, we also have the roar system for staff dress purposes. Fire extinguisher cabinets are obviously all locked. That key actually gets replaced with the proper one. Fire extinguisher signs, sprinkler heads, raven heads, Hanwha cameras, Viking phones, anti-ligature artwork, curved edges, pig-proof caulked. This is another door. This actually connects one of the other wings of the hospital to this. It's required for egress, but it won't be used by patients on a regular basis. Comfort room to the right, group therapy, nurse station here ahead of us. Treatment planning room is behind that. Group therapy room. We have a quiet activity room here. Patient public phones. And into the seclusion suite. Bathroom to the right. 2 seclusion rooms. Each seclusion room with badge access, of course. Also have the key override, so that should someone be stuck in there and they need to get out, or there's an issue with the mag locks, we can just cut the power to it. Within each seclusion room, we also do have the hidden card reader here. So you just swipe it and then you can get out without any problem. Moving down towards the patient wing itself. Water fountain and bottle filler, anti-ligature cabinets, all locks. Typical patient room. Typical non-ADA bathroom. And we'll go into room 603. This is a ADA room, so it does have the CPAP. Instead of having 2 bedside tables, we figured we'd save some money and just do one CPAP cabinet and 1 outlet. On the corridor side, of course, we have the outlet cutoff switch as well, so we can control when power is flowing to that. ADA accessible shower. Hoses obviously are not kept here, the quick connect hoses. They're kept in storage closets. We also do have the patient curtain system here, so sensors on the ceiling, So at night, everybody needs to stay in their own bed. Another one of the ADA rooms. This is the IDF room. Got our roar system there. Got some shelving. We've got the access control systems. There is a drip tray above this, and we've got a sensor for that plugs into the APC unit down below for the environmental monitoring of that. Camera switch, which goes from MDR back at the MDF, and then obviously just a normal network switch here. Dedicated HVAC. Our evacuation plans posted. One of the things that we changed on this wing compared to what was done in the rest, in the balance of the hospital, these doors used to be about 6 or 8 small little doors for storage. The challenge was that they were not being closed and locked on a regular basis. So we went ahead and just did storeroom function lock sets, conventional doors and closers, so that take the human element out of it. New signage. Anti-barricade doors, the PEMCO hardware there, so should we need to get somebody out of the room, we can always just swing the door in the opposite direction and do so. Key control for mag locks, should we want to close down one half of the hallway, if they're at a time of low occupancy, we can do that. You will not see a fire alarm pull station at this end of this exit hallway. We were shorter than the required distance for that, so we didn't have to do that. Of course, the protective covers on all the fire alarm annunciation devices. Did pick some artwork for the adolescent wing in particular. And just go back into a normal bathroom there. Head back towards the nurse station. We're going to be putting some caps on the tops of these. Of course, sink, dual monitors, and a printer. We are going to mount these monitors. The paperwork here typically wouldn't be left out, but this is for their competency. Nurse training, going through the training, getting ready for things. This is the access control mag locks. So should we need to get people out in a hurry, we can drop the mags. This is the patient curtain system with the individual buttons for the different rooms. So at night they can arm that. Fire alarm annunciator panel. Key locked fire alarm pull stations, emergency power off for the HVAC, or the anti-ligature digital clocks that shows the date and the temperature as well. And go into treatment planning. A table in the middle with power underneath. Phone available there, speakerphone. These are the older Envoy Innovate workstation wheels. We've got computer large monitor there for presentations and training and purposes. We also have the two always on monitors for the two seclusion rooms. These are the vital machines on their carts. We've set up the CAPSA tag carts here with the InPro rail system. That one is strategically placed so that folks can kind of keep it charged there, but then they can also sit at that unit and have a good view when the vital machines aren't there, looking out the hallway. And this is just shows you the connection for the wireless charging carts. So two more carts over there. Got the scale, staff bathroom. We've got the Roar system here and the iPad for enunciating on this wing. A refrigerator there for keeping, it is a med fridge. It didn't need to be a med fridge, but we actually got it for the same cost. And of course you get a better compressor and warranties on that than you do with a dorm fridge. That's mainly just used for keeping juices and things that the patients may need. So it's not really used for medical, clinical purposes. And IT's iPad charging station there, as well as their phone system, their emergency phone system that they're using, a newer system, and I can't remember what it's called. We're gonna put some wall cabinets up here for more storage, so they have some more storage there as well. Med room here with the Omnicell, the med fridge, computers in the corner, roll-up door, locked cabinets, sink, all the correct postings, etc. Security control for security that's also set up with the numeric keypad and swipe, so you have to have the PIN as well as the valid swipe to be able to get into that room. And a break room, staff break room, just a small table there, some lockers, microwave, ADA accessible. We did get a Scotsman water and ice dispenser there, coffee pot, coffee maker, and refrigerator, freezer in the corner. And a little clock on the wall. Anyways, that's a tour. Hope you enjoyed it.